Om Amriteshwari Nama. Humble pranams at the lotus feet of our most beloved Amma. A very good afternoon to this distinguished and august assemblage. With profound reverence and heartfelt gratitude, let us commence this auspicious session by invoking the divine blessings of our beloved Amma, Shri Mata Amridandamai Devi, whose transcendent compassion, spiritual sagacity, and unwavering commitment to humanitarian service continue to illuminate our collective path. May her divine grace sanctify this gathering and endow us with wisdom and an enduring spirit of excellence. In keeping with our rich cultural ethos and time-honored traditions, we shall now proceed to the lighting of the lamp to seek Amma's divine blessings. I respectfully and reverentially invite Brahmacharini Dr. Rehnaji to kindly grace the occasion by lighting the ceremonial lamp and invoking blessings from Amma. Thank you, Rehnaji, for raising the solemn ritual. It is with immense privilege, profound honor, and a deep sense of responsibility that I am Kesia Joji, finally a physician associate, standing before this eminent congregation to extend a most cordial and gracious welcome to each one of you to the AMRITA alumni session at the Kochi campus. Today's intellectual event is centered upon a theme of exceptional contemporary pertinence and transformative significance. The topic is From Support Role to Smart Clinical Partner, AI's New Role in Allied Health Practice. This theme encapsulates the paradigm shift currently redefining the contours of healthcare delivery, wherein technological innovation, clinical acumen converge to create a more dynamic, efficient, and patient-centric ecosystem. Respected dignitaries on and off the dais, distinguished guests, revered faculty members, all heads from various departments, dear alumni, online and offline participants, and dear students. At the outset, I consider it a great privilege to extend a heartfelt and respectful welcome to Dr. Prem Nair Sir, Group Medical Director and Provost, AMRITA Hospitals, India. Sir, your visionary leadership, unwavering dedication, and exemplary contributions to the field of healthcare and medical education continue to inspire us all. We are truly honored by your gracious presence among us today, and he is always a big support and the pillar of KOCHI alumni. Now, we are deeply honored by the gracious presence of Dr. Anand Kumar Sir, Emeritus Professor of Neurology, whose esteemed contribution to the field of neurology continue to inspire generation. Sir, your presence adds immense value and prestige to this occasion. We are truly privileged to have you with us, and especially we are delighted to learn that Mr. Jayesh sir was your favorite student, and it made us especially happy to see how fondly you remember your students. Now, in his absence, I take the opportunity to respectfully acknowledge Dr. Girish Kumar Sir, Principal, AMRITA School of Medicine, Kochi. Sir, your steadfast commitment to academic excellence and relentless pursuit of nurturing future healthcare professionals is deeply admirable. It is with great respect that I welcome Shri MVG Thampi Sir, Chief Program Administrator, AMRITA Center for Allied Health Sciences, Kochi. Sir, your administrative acumen, tireless efforts have played a pivotal role in the growth and success of the institution. We are deeply privileged to have with us our esteemed speaker for today, Mr. Jayesh Janardhanan Sir. Sir, your presence adds immense value to the gathering, and we are eagerly looking forward to gaining insights from your expertise and experience. I extend my sincere and respectful welcome to Dr. Rekhna ji for gracing the occasion with the solemn ritual. Now, I extend my sincere and respectful welcome to Dr. Prasad Viji Sir, Associate Professor, Program Coordinator, Coordinator for Transplant Surgeries, AMRITA Center for Allied Health Sciences, Kochi. Sir, your dedication to both academic and clinical excellence is truly commendable. A very special and heartfelt welcome is reserved for Dr. P.G. Nair Madam, Emeritus Professor of Pharmacology, Chief Coordinator for Kochi Campus Alumni, and Coordinator of the Nodal Office for Statutory Inspections. Ma'am, your unparalleled wisdom, unwavering commitment, and invaluable guidance have been a cornerstone of strength and inspiration to this institution. Your continued mentorship illuminates the path for both students and faculty alike. Esteemed guests, your distinguished presence not only elevates the significance of this event, but also serves as a source of encouragement and inspiration to all of us gathered here. We shall now proceed to the lighting of the lamp. I respectfully and reverentially invite all the dignitaries for gracing the occasion by lighting the lamp. I would like to invite Dr. Anand Kumar Sir, Dr. P.G. Nair Madam, Rekhna ji, Shri MVG Thampi Sir, Dr. Prasad Sir, Ebin Sir, Arya Ma'am, Revati Ma'am, and Babita Ma'am for gracing the occasion. It is now my honor and distinguished privilege to invite a visionary par excellence whose exemplary leadership and unwavering dedication have significantly contributed to the advancement of healthcare and medical education. Dr. Prem Nair sir, Group Medical Director and Provost, AMRITA Hospitals, India, to deliver the presidential address.
Om Amriteshwariya Namaha. Alumnus, Mr. Jayesh, Janardhanan, faculty members, staff, and students. It's my pleasure and privilege to join you all on this special gathering hosted by the AMRITA Alumni KOCHI campus. We are honored to host a thought-provoking session titled From Support Role to Smart Clinical Partner, AI's New Role in Allied Health Practice. This is led by our distinguished alumnus, Mr. Jayesh Janardhanan. Healthcare is undergoing a rapid evolution, and artificial intelligence is no longer a distant concept. It is already reshaping clinical practice as we see today. Particularly in allied health sciences, AI is empowering professionals to transition from traditional support roles to intelligent decision-enhancing clinical partners. The shift demands not only technical adaptation, but also the mindset of continuous learning and innovation. At AMRITA, we strongly believe in nurturing such adaptability. Our alumni are our ambassadors, and sessions like this create a powerful bridge between academic training and real-world application. It is heartening to see our alumni returning to share knowledge, mentor students, and contribute to the growth of future healthcare leaders. I wish to appreciate the efforts of the organizing team and faculty who have made this hybrid session possible, ensuring participation beyond physical boundaries. I am confident that today's interaction will spark new ideas and inspire all of us to reimagine the future of healthcare. Om Amriteshwariya Namaha.
Thank you, sir, for that profoundly insightful and intellectually enriching address. I now humbly request Dr. Anand Kumar sir, Emeritus Professor of Neurology, to kindly address the gathering and share a few words with us. Sir, we would be truly honored to hear your valuable words.
Good afternoon to all. I have not come prepared for a speech. Anyhow, AI in healthcare, I think if you take any aspect of healthcare, AI is it in place. For example, in prevention of disorders, diagnosis, treatment, identification of complications, and also for positive health, so-called Saukyam, for everything, AI is there. There are many doubts which arise, especially in the social media, as to will there be any problem for the doctors and also the physician associates if AI is going to take over. But the clear answer is that there will be a difference, but that difference will be between a doctor who is AI enabled and a doctor who does not have AI knowledge. So that is going to be the difference. Because the most criticized subspecialty is radiology. But here also you will find that there are a lot of things to be solved, like the legality, the ethical issues. So each country has its own laws governing the artificial intelligence process. So AI is going to stay. So I got interested in medical AI in 1985. So I worked in an AI lab, and we produced an expert system on epilepsy. That is to mimic the expertise of an epileptologist in a system. From those days, AI has grown in leaps and bounds, and now the emphasis is on data. That is big data. So we have got the most eminent method of solving problems and decision making, that is by pattern recognition. So most of the time we used to have logical systems, but now we have AI systems which are heuristically based, which means that it's a rule of the thumb approach, which will take you somewhere near the solution. To quote an example, if a patient comes to my OPD in a stooped posture with tremor of the both hands and expressionless face, I will immediately think about Parkinson's. 99% of the time I will be correct. There's a 1% chance that a mimicry artist may come and he will be showing all the features of Parkinson's. But apart from that, heuristics is a very fast way of identifying things. So similarly, you have got this intuitive system of mind, which also to some extent is mimicked by the neural networks in the computer systems. Because we have got an input, we have got an output, but we have no idea how the system or the neural network is analyzing that particular problem. So it's something very similar to the human mind. Having said that, there's a flip side also to AI, because the most recent study from MIT has shown that people who are regularly using ChatGPT or Google Gemini or Perplexity, they have found that there's a 33% drop in neuronal connectivity. And also, there's a substantial decline in the creativity. So I think one should wave a hand of danger in non-judiciously using AI systems. It is going to hamper your creativity to a great extent, and also to reduce your neuronal connectivity, because it's so easy. You just put in a problem and within seconds there is a solution, there is a very structured reply coming from somebody who is so much of supportive. He is going to ask you questions, how you want it, any further refinement is needed, never get bored with you. So those things are there, but still I think I would like to quote Einstein. Einstein has told that I would not live to dwell in a society which is run by the AI systems, leaving a bunch of idiots. So I think one should be very careful in judiciously using the AI system, but it should be used where it has got a place. And to talk about Jayesh, Jayesh and Raju were my first physician associate students, and we learned together, because I remember the day when I sat with Narayan Nunni and we were asked to chart out a curriculum for physician assistant program by Dr. Prem. And we ran through all the curriculum which were available from Western universities, and we sort of modeled one for AMRITA. So there is a beginning of the Allied Health Science program which happened in my chamber. So from those days, and because we had a dearth of junior doctors, that was a reason why we chose to have this program. Now it has blossomed to such an extent with the input from Prathapan sir, Thambi and Rehnaji. All those have contributed immensely to the growth of the Allied Health program in AMRITA. And about Jayesh, he always comes with a new version of Jayesh. Lastly, when he came, it was Jayesh 2, or now it must be Jayesh 4. Constantly he goes on updating. And Jayesh has got a very, very attractive human side also. So he's so much supportive of his the alumni and also to his alma mater. Because I remember the anecdote which was told some time back that you are invited for a conference and Jayesh calls at the right time and says how you are going, what dress you are wearing. And he sponsored his suit, if I am correct. So, and he did not want any publicity for that also. So that's a human side of Jayesh, and I'm extremely happy that I'm here today to speak a few words on AI and also my dear Jayesh. Thank you so much.
Thank you, sir, for your insightful and enlightening words. Next, it's my honor to invite Shri MVG Thampi sir, Chief Program Administrator, AMRITA Center for Allied Health Sciences, Kochi, to offer his felicitations.
Anyway, I prepared a speech, it disappeared. So respected Dr. P.G. and Madam Rehnaji, Anand Kumar, and my dear students and faculty members, it's really interesting to know this AI technology because it is totally turning the healthcare scenario. And today, a couple of days back, I went to one of the furniture shops. And for my friend, he wanted to have a dining table. We were selecting the dining table. Then that salesman told us, "Sir, this is AI-enabled dining table." So we are surprised how a dining table could be AI-enabled. Then I asked him, how could? Then he said, the machine manufactured this using AI technology. That's why the shape and size has come like this. This is not human mind, it is a different mind. See? So AI has intruded into our minds, and as Anand was telling, it is even a false notion that AI will do everything. No. AI has great role in healthcare system, enabling, sharpening the laboratory investigations, the radiological studies, rehabilitating the patients by physiotherapists with modern tools, and even dietitians giving personalized diets using AI technology. And surely this has a very relevance today's allied science professionals because AI has a great role to play to develop your professional career. As I always used to tell you that you people are going to be, or rather bridging the gap between a physician and the patient or a bystander, where AI tools will definitely enable you and help you to make more and more patient care oriented. And today, I am very happy that our alumni, Mr. Jayesh Janardhanan, is here to share his thoughts with you on AI. Because he is a very smart guy, as Anand was telling, he is working with Dr. Anand Kumar. So when I entered AMRITA, he passed out and he became a professional here, working with Anand Kumar. Only Dr. Anand Kumar introduced Jayesh to me. And he is a very smart guy, and he is a very knowledgeable person, and really appreciate his love towards his alma mater, to this institution. Whenever he visits India, he visits us, he talks to our students, motivate them and inspire them. So thank you, Jayesh, for being here with us, sharing your thoughts on AI with us. And I also appreciate, congratulate and thank Dr. P.G. Nair Madam and her team for organizing such a program, such a great program. It's enlightening all of you, motivating our students. So thank you, Madam, for motivating our students, bringing this alumni to us. These are all the living examples of the product of these great institutions. So thank you very much. Wish you all success. Thank you.
Thank you, sir, for your most encouraging and perspective remarks. Every distinguished discourse is preceded by a befitting introduction. To formally introduce our esteemed speaker for today, I invite Dr. Prasad Viji Sir, Associate Professor, Program Coordinator, Coordinator for Transplant Surgeries. Thank you.
Om Amarteshri Namaha. It is now my privilege to introduce today's speaker, Mr. Jayesh Janardhanan. Mr. Jayesh is a physician assistant, healthcare consultant, and strategist for more than 15 years of experience in driving digital healthcare transformation. He has had several strategic initiatives at Cleveland Clinic, Abu Dhabi, and has earned international recognition, including the prestigious HIMSS David Award for transforming infusion clinic workflows. Personally, this introduction is very special for me because I have known Jayesh for nearly 2 decades. I have seen his journey from his student days to becoming highly respected professional in the international healthcare sector. His growth, dedication, and achievements are truly inspiring. For many of our physician assistant students and allied health science students and young professionals, Jayesh is a beacon of light and an example of what is possible with hard work, commitment, and vision. He is one of those rare alumni who never forgets his roots. Whatever he has achieved, he has always tried to give back to the institution and to his profession. He has continued to stay connected with us through guest lectures, monitoring and guidance, and continuous support to our students. He keeps coming back and inspire to the next generation, and that is what makes him not only a successful alumni but also an ideal alumnus. It is truly an honor for me, for the entire Allied Health Sciences and Alumni Association of AMRITA Kochi campus to host him today. He is a role model for all of us and proud recipient of Distinguished Alumni Award of AMRITA Alumni Association. Please join me in welcoming Mr. Jayesh Janardhanan. Thank you.
Thank you, sir, for that comprehensive and eloquent introduction. We now arrive at the most anticipated and intellectually stimulating segment of today's program. Now it's my great honor and privilege to introduce our distinguished speaker for today, Mr. Jayesh Janardhanan, sir. Ladies and gentlemen, please join me in extending a warm welcome to Mr. Jayesh Janardhanan, sir, and give him a big round of applause. Sir, now the stage is all yours.
Thank you for the kind introduction. Okay, so respected Prem Nair sir, Anand Kumar sir, Thambi sir, Rehna ji, and PG ma'am, thank you for inviting me over here. So today I will be walking over through how AI can support allied health professionals and how what are the tools out there right now, how the artificial intelligence landscape is emerging day by day. Okay, so before starting the session, I will take you through some of the verbiages used it in the currently using, or you will be hearing every day in the artificial intelligence world. Okay, so speaking of which, what is an artificial intelligence is, and everyone may be knowing that it is a systems that mimics the human intelligence. It may not be completely fully able to mimic it, but it can do almost 90% of the human intelligence way of doing things. Okay, so next terminology you'll be hearing will be the machine learning. Machine learning, nothing. It is enabling a computer to learn data and give you an output based on the data you are feeding it. It can be in different ways of learning is there. It can be a supervised learning that, like, somebody is saying that out of 6 elements you have fed into this system, it can be, and this is A, this is B, this is C, this is D. And when you ask for an output, if you show C, the system will give you an output. That is the supervised learning. Okay, mainly used in the predictive analytics world, especially disease prediction. And we will come to healthcare, it will be in the disease prediction or reporting or report classifications, dashboards, etc. Next, it will be unsupervised. There is no teaching element is there. You will be feeding data into the system and you are asking the system to give me an anomaly from that group of data. So usually used in the patient clustering. For example, if you want to identify a specific set of patients from a specific set of demographics, you will be using this type of machine learning method. Next will be semi-supervised. Usually, it will be used in the medical imaging side. As mentioned, it's a semi-supervised. It is a partial teaching, partial system learning from its experiences. The fourth one is the reinforcement learning. It is reward-based. Usually used in the treatment optimization, means once you ask for an output, you will be having the database in the system and you will ask for an output, it will give an output, and if it is not correct, you will give an feedback. So then it will correct it themselves. Okay. The last one, that is the deep learning, where it will utilize the neural network technology and it will work like almost like how the brain works. Usually used in the places where huge amount of data is being analyzed, like radiology imaging analysis, and in ophthalmology database analysis and histopathology, etc. So next word you will be hearing throughout this presentation will be large language models. So large language models is nothing but it's a deep learning model trained on huge text data sets. Okay, so it can be used in different industries, and healthcare also utilizing it, to expedite the patient journey in the hospital or give a better patient care experience. Okay. So there are multiple LLM tool types are available. It can be a general LLM type, mainly used for report drafting. It can be a general plus enterprise type of LLM that is used for clinical summarization. Then you have automation type of LLM is available. And you will have enterprise platforms for deploying these artificial intelligence solutions. And you will also have on-premises or your own LLM hosted it on your premises or on your cloud database. Okay. Finally, the terminology will be natural language processing. As its name says, it allows the machine to read, understand, and respond to human language in a meaningful way. So what is artificial intelligence in healthcare? So in healthcare, AI is being exploited in different ways. So it will be machine learning algorithm or machine learning databases or data analytics or generative AI tools or automation-based techniques being used in healthcare. So if you look at the timeline of AI is being started, into a full-fledged development starting from 2010. Okay, that is the time the machine learning concepts started coming into picture. And as I mentioned before, it was used mainly for predictive analytics purposes. So in predictive analytics purpose means it will analyze the historical data and give you a score, or you will give an output based on your criteria. For best example would be a sepsis prediction. So this predictive analytics tool will be keep on analyzing the data. It will be dynamic always because the patient data keep on changing whenever there is a change in blood pressure, and so there is a change in the temperature. Based on the latest data, system will predict the risk of developing a sepsis in the ICU setting. Next one is the generative AI that actually started developing somewhere in 2017 and it actually matured somewhere in 2023. That is the time you may have heard about the chat GPT 3 and 3 came into picture. So, but still it is evolving. Okay. So generative AI usually creates new content out of the existing database available. Okay. So I will take you through each examples in the later slides. Now we are actually going through agentic AI. Agentic AI platforms are usually used for autonomous actions and usually used for streamlining complex healthcare processes, and it also can do uh, human-like behavior. It can adapt based on the situation, and it can actually give you an output, or it can perform a task. Finally, from 2027, starting next year, we will be going into an integrated system type of development. That is the prediction. So in integrated system, all these AI platforms will be working together. Okay. So you may be seeing robots as a nurse or robots as a pharmacist in the near future, starting 2027 by 2030. So nobody is predicting what is going to happen over 2030. Somebody may say, AI can develop their own intelligence, their own language, they will start talking each other, then that is going to be a biggest challenge. So there should be, checks in place to avoid that is going to happen. We'll see what is going to happen in the next 3-4 years. But if you're looking at the development cycle, you can see that the AI landscape is evolving very rapidly than you expected. So as I mentioned before, I am coming to one of the agentic AI concept, that is, the generative AI field. So what is generative AI? It means it is actually creating a new data based on the existing data. If you look at the predictive analytics, it is never creating a new data. It is giving an output based on the existing data. Okay. So where generative AI fits in, in a clinical practice, if you want to write a discharge summary, and if you draft a referral letter or synthesize a SOAP note. SOAP note is your regular progress note. It is subjective, objective assessment and plan note. And or if you want to do this task, the generative AI will be your right tool to do that, because you can save a lot of time, because it goes through the whole patient data and will give you a beautiful summary. Only thing you have to do is just read through it. If it is acceptable, accept it. Okay. It also can be used in creating clinical insights. For example, if you are seeing a patient which now in the outpatient clinic, the patient has visited several times in several clinics, and if you want to know about this patient more, you have to go through the whole chart to get a summary, right? But if you have this clinical insights turned on or clinical summary option turned on, what it will do is it will give you a beautiful summary of the what happened to the patients for the last 3 years, 5 years, and you will get a sense, what we can do quickly to this patient. So your visit will be shorter. You'll be taking less time in analyzing the data, giving a better care for the patient. So where the generative AI fits in, and as I mentioned, it can be used in before visit. You can review the chart to see what happened to the patient in the past, and you can also see what are the risk factors this patient is having. And during the visit, the ambient documentation, I will come to this in the next slides. And the later point, in the after visit, you can actually create discharge summaries, notes, referral letters, follow-up letters, or do a follow-up outreach programs. All those areas, generative AI will be very helpful. Next scenario, if you have a patient who admitted for a long period of time, and you got now the patient got discharged, you need to train the patient on a specific condition, specific medication, and those places you can utilize generative AI technology so that the agents will reach out to the patient and take you through their condition. They will educate the patient what to do next. So this will freeze up the times of the clinical caregivers, and they can actually concentrate on the patient care more effectively. So this is eventually taking out your some of the administrative burden. And during the conversation, if the AI system detects any anomaly at the end, and the patient is saying that I am not well today, then it can connect to a real caregiver or real clinician to address the patient. So I will be taking through different roles, how AI is going to help. Okay. So if you take a physician associates or physician assistants, so the most useful tools will be generative AI, ambient AI, and predictive analytics. So generative AI, they can use for their day-to-day patient visits. Example, the outpatient, they can, generative AI technology helps in giving the summary. And in the inpatient world, now during rounds, and they will get a sense of what is happening with the patient. And using ambient AI in the outpatient clinic, you are just listening to the patient, and that data will be transferred into the system in a beautiful, structured, medically consistent note. And the predictive analytics will give you the risk the patient is going to develop, so that you can inform the clinician, physician well in advance, and you can take care of the patient well. So I am going to show you a video about how ambient technology is transforming healthcare. That's why I didn't speak more about this one. So Athena Health, one of the leading healthcare facility in US, they developed ambient technology-based application. And in this video, they were describing how this technology works.
Ambient Notes empowers clinicians with ambient listening to record patient visit conversations and generative AI to summarize the patient visit. To begin, the clinician opens the Athena One mobile app and clicks on the Start Ambient icon on the specific appointment. Next, the clinician confirms patient consent and the visit recording begins. Conversation during the exam is captured by the ambient listening technology. Once the conversation ends, Ambient Notes summarizes the clinician's observations. The summary can be previewed prior to placing it in the patient encounter or sent directly to the chart. In the patient encounter, the clinician can review and edit the visit note using either the Athena One mobile app or the desktop version of Athena One. By automating clinical note documentation, Ambient Notes saves clinicians valuable time, empowering them to dedicate more time to patient care.
So as I mentioned before, the ambient technology is very useful in the outpatient settings. It can used in inpatient, but there will be a lot of complex scenarios comes into picture. Well suited for outpatient clinics. During the visits, it will capture everything and files into the patient chart. So you will get a face-to-face interaction with the patient instead of your keep on typing in front of the computer. So if you look at the other allied health professionals and like a diagnostic technologist, right? Like a radiology, MRI, or CT technologist. So in the traditional way, they usually faces a lot of challenges, right? First one is usually they have to manually review the image quality and wait for the radiologist to flag urgent cases, because without manual review, you may not know, which case needs to be interpreted first. There may be a stroke patient in waiting to get the result back. So if you are not sorting out the prioritize the cases, the results will get delayed, the treatment will get delayed. Okay. The same way, the slice quality or motion artifacts. And when the patient is not steady, there will be artifacts will be generated. This is actually causing problems to everyone, right? So the patient needs to go through re-imaging. That will take up the time of the text. It will take up time of the patients as well, and will create a lot of patient experiences. So if you use artificial intelligence, what it can do is, based on the once the imaging is over, system will flag if there is an abnormality in the image captured, and will it will prioritize for the reading by interpretation by the physicians. Okay. And The same way the algorithms can also can scan raw data and during acquisition, and actually it's flags critical findings in front of the radiologist itself. And AI-enabled noise suppressions can reduce the noises in the background or movement artifacts. So it will reduce the image quality. You can reduce the repetition of imaging, and that saves everybody's time. So coming to dialysis. So in routine dialysis, usually they have to statically monitor the patient vitals because patient may develop hypotension during the dialysis sessions, right? So you have to monitor very carefully, and you also have to take, now you will be doing a reactive care in those sessions. Once you will only do intervene when you realize that, there is a hypotension is being developed. But if you, in a AI transformed setting, what it will do is, based on the patient previous data, it will predict the hemodynamic changes well in advance, so they can take effective measures before that event is happening. So there are a lot of products in the market which is actually utilized in the dialysis field or in the nephrology side. So the one promising one is in development is the mouthguard biosensors. It's like a wearable which can detect the creatinine levels in real time, so that it can actually interface with the EHR system wherever the hospital is having. Then the physicians will be getting a real sense of what is happening with the patient. The patient is inside the hospital during dialysis. It can actually monitor and send the data to the dialysis technicians to inform that there is a change in creatinine levels. Coming to the sleep and language pathologist. So most of the time in a traditional work setting, they will be facing a lot of administrative burden. And usually the therapy progress is they have to track manually between weekly sessions. So they have to bring the patients on a regular follow-up to see how the patient is progressing well with therapy. So once you use AI-based tools, you can have a mobile app which can give to the patient. They can practice 24/7, and whatever the output is coming back, it will send back to the therapist. They can review whenever they have the time, and they can see how the patient is progressing. If needed, they can bring the patient back to the hospital again. And you can also utilize automated documentation tools like the generative AI tools, which I mentioned before, for capturing the notes or capturing your follow-up details. And there is also AI-powered pronunciation correction tools are available, and which is very useful for pediatric population in correcting their pronunciations. Coming to pulmonary function technologist, usually in a PFT technologist, they have to use manually interpret results from the PFT machines, and they also faces scheduling and prioritization challenge like we have seen in other fields. They don't know which patient needs to be seen first, which patient needs to be prioritized at the end, and the no-show visibility. Some patients may not show up for their appointment, and if there is no visibility, then what they will do is they will be keep on waiting for that patient, or the slot will be occupied. The patient never shows up, so the needy patient will not get the slot on time, right? So once you using AI-based tools, you can actually labels a COPD pattern in the when you perform the test, and you can also find out the poor effort or blow errors while they're performing the test, and it also gives you the repeat test suggestions. And from the prioritization front, using artificial intelligence, you can prioritize severe cases. System will now automatically prioritize severe cases based on the previous patient data or current data available in the system. And no-show predictability. So this is actually useful in across the field. If a patient is consistently no-show for appointments, you can actually take out that slot and give it to a patient who deserves it, and you can actually prioritize the no-show patient can give a slot later. So coming to the neurotechnology, so when you look at the EEG, one of the main challenge would be facing is scrubbing of EEG artifacts. EEG artifacts can be uh, due to many reasons. It may be due to any lead connectivity issue, or it may be most of the day it will be due to the patient movement, right? So there are AI filters are available which will suppress the background noise, means it will remove the unwanted signal interference and will smoothen the EEG waveforms. And there are also tools available which will give the seizure prediction or seizure detection based on the EEG data. And there are also wearables coming into picture. It is in under development, like Epi monitor, which can actually detect seizure in advance and alert the technologist or the physician. Optometry. If you go to a eye clinic, most of the time what happens is their slot will be occupied, optometrist slot will be occupied by the patient who is needing either visual field testing or a fundus photo. So fundus photo is mainly for the diabetic patient will be referred for a fundus photo, and they will be actually waiting with other ophthalmology patients in performing their test. So now there are AI-based solutions like virtual reality headsets. Okay, you may be seeing virtual reality headsets being used in the gaming field, but the same VR headsets are repurposed for detecting visual defects. It can detect glaucoma or retinopathy. There is Hero Prime is one of the product available. And next is automated fundus photography. There are devices available will capture the fundus photo without the intervention of an optometrist, and it can also send a result back to the EHR system or EMR system, and it will flag if there is an abnormal, and the flag will be on and it will alert the physician saying that, okay, this automated result is having an abnormality. Please review to make sure that it is correct. Finally, to the cardiovascular technology. So cardiovascular technology, they may be performing multiple jobs, right? They will do echo reporting, they will do ECG interpretation, and they will do other cath lab procedures, right? So in a traditional workflow, they will be usually doing the manual tracing, and there are a lot of physical effort is involved. That is in terms of echo reporting. So there are automatic tracing is available. It will save around 50% of time, and 50% fewer manual clicks, means that the physical and cognitive burden or strain will be less. And the ECG interpretation, the AI tools can flag critical cases instantly so that the physicians or the technology can take an immediate action. And the triage, okay, so cardiology is a place where you have to triage patient correctly based on the urgency, and there are AI tools can triage based on the urgency of the patient. So it can move the critical cases on the top for the for performing either an echo or an ECG. And you can also use it for rural outreach programs. Okay, so using the AI technology, even a junior staff can capture expert quality echoes or ECGs. Now, as we scanned through most of the allied health scenario, so there is a hype also in the market saying that AI can do and AI can do everything, right? So, but if you look at the real applications, most of the time it is being used as a companion to reduce the administrative burden or reducing their other physical activities, and it is not fully utilized. But if you look at the media or any other channels, they talk about robots are already into action, they are doing every care, but we are not into that one right now. It is all hype, and we may reach that reality in the near future. So this is a very important aspect, the personalized care. As we advance in the healthcare, the genomic data plays a very crucial role in identifying diseases and preventing diseases in advance. So before emergence of AI itself, genomic data is there, but analyzing that type of humongous data is very time consuming. Now with the advent of AI tools, it is very easy to analyze genomics data. So based on that, there you can actually tune or change your or tailor the treatment. So the patient will be actually treated well, or he can predict the diseases like cancers well in advance. So we can prevent such an adverse event is or such a dangerous disease is causing to the patient. One of the main advantage, no need to explain, I know that. Okay, so in the precision medicine, we call it as precision medicine, genomic based therapy planning. So you can actually tailor the medicines based on the patient's genomic data. For example, a patient may need 500 milligram of paracetamol for reducing the headache, but that dose may not be applicable for another patient. So based on the genomic data, you can give 650 to the next patient, say, and in another patient is just 250 will be enough. So that patient will not be taking excess or low dosage. So when you talk about artificial intelligence, you have to also consider the ethics, the bias, and the human in the loop concept. So what is the bias issues are the algorithmic efficiency. So systems or the AI systems are working based on the algorithm you created or the human beings are created. The data is being fed, right? If the data is incorrect, partial, or you are giving inappropriate data and you are giving inappropriate algorithm to detect a outcome, and you will be ending up with the wrong outcomes. So that is the biggest disadvantage in the AI field. Next one is the ethics, the patient data privacy. So when you export the data into an AI tool, you have to make sure that the data is not reaching wrong hands. Most of the countries are coming up with the laws to protect this one. For example, in US, HIPAA is strengthening its framework to cover artificial intelligence as well. The same way Europe is using the GDPR, General Data Protection Framework, that also actually updated recently to cover AI related incidents where patient data privacy is not being breached. Finally, clinical safety. So there comes the human in the loop concept. So clinical safety based on the AI decisions or AI, you made a decision based on the AI suggestion. You have to make sure that whatever the AI's output is accurate. So when you design or when somebody is designing a tool, they have to make sure that the human in the loop concept is being taken care of. So the final decision maker should be the clinician. He will say that, okay, whatever the suggestion, the prediction score given, the notes generated, the summary provided, and the ambient technology created the SOAP node, everything is accurate and there is no hallucination happened, there is no wrong data is being captured, and it is not going to harm patients. The hallucination is nothing but when during an ambient listening, the patient is saying, I am having a temperature of 98.4 degrees Fahrenheit, the AI system can capture it as 100 degree. Okay, so there from a no fever to patient is having fever, a condition is being emerged. But if you are not paying attention, that can harm patient. So if you look into the AI landscape, what you have to do so it to survive in the next or in the future period of time. So you have to have a AI literacy, right? So you should be knowing what are the technologies out there, how you can utilize it in your day-to-day practice without harming patient health. Next is clinical prompting. So most of the AI solutions will give you an answer based on what you asked for. That is called as a prompting. If you don't know what to ask, you may not get the right answer. So you have to develop the skills to prompt it correctly. So you will get the right answer. You can take the right decision. Next is algorithmic stewardship. So it's nothing but for a healthcare application, the allied health professionals can play a crucial role in the development. So you can decide what should be the algorithm, what should be the output. Okay. So that will make sure that we are going to implement an ethical AI solutions to be used in the healthcare. So this is the last as audio clip. I would like to play it over here. This is nothing but a post-op or post-procedural call is being made by a AI solution. This solution is developed by a startup company called as Hippocratic AI. And here a care manager is calling the patient to talk about their medications, how they are taking the medication. I'll play for 1 or 2 minutes, then I will stop it.
Hi, I'm calling on behalf of Dr. Chu from Memorial Hospital on a recorded line. Is this Jane Anderson?
Yes, this is Jane. I'm sorry, who am I speaking with?
Hi, Jane. This is Rachel, your AI chronic care manager. Your cardiologist, Dr. Chu, asked me to check in on you. Is that okay with you?
Yes.
To protect your privacy, can you please share your date of birth?
Yes, I sure can. It's January 1st, 1950.
Thanks for confirming that. I'm your AI chronic care manager. Do you have time to chat now?
Yeah, I do. I have a little bit of time.
Excellent. Thank you so much for taking the time to speak with me today. Before we dive into your health, I'd love to get to know you a bit better. Is that okay with you?
Sure, of course.
I'm so glad you're open to chatting. It really helps me understand you better. Is there anything you're looking forward to doing this week?
I'm finally out of the hospital and I'm trying to get my strength up because my grandbabies are coming to visit me. So, I might not be running around like I used to, but grandma's got a job.
Oh, that sounds like so much fun. I'm sure your grandbabies can't wait to see you. It's great that you're thinking about getting your strength up for them. Now, I want to make sure we cover everything Dr. Chu wanted me to go over with you. We'll be discussing your medications, diet, and a few other things. Sound good?
Yeah, that sounds good to me. Thank you.
Let's start with your new medications. I'd like to go over them one by one. The dosages I have are from your medical record at Dr. Chu's office. Can you tell me if you've picked up your new prescription for Lasix?
I picked up my prescription this morning, but the medication says something like furosemide or something like that.
I think I can help clarify that for you. Furosemide is actually another name for Lasix. So it sounds like you did pick up the correct medication. Can you tell me if you've started taking it as prescribed twice a day?
How many milligrams is it supposed to be?
According to your medical record, your prescribed dosage for Lasix is 40 milligrams twice a day. Are you taking it as directed?
Okay, yes. Okay, so I'm relieved it's the same medication. Yes, so I took one this morning.
Okay, so I'm stopping it because it's a long video. So that is one of the agentic AI and the generative AI combined solution is out there. So this is the way healthcare is transforming. You can see that most of the redundant work or manual work can be taken over by the AI. And whenever there is a problem, it can flag you back and you can take over from there. So what does that mean is, for example, in a hospital setting, if you are using a 10 professionals for doing a post-op calls or post-discharge calls, if AI is going to do it, you only need 2 people. Okay, that 2 people should be AI enabled, right? So they knows about how to utilize this technology and how to run this technology. So that means in the near future, there will be a lot of impacts you can see in the healthcare world. So nothing to worry, only things you have to embrace the technology. You have to be ready for that. Okay. So I will be concluding my session here. And if you have any questions.
Thank you for your time and attention. Questions, thoughts, or experiences to share?
We now open the floor for questions. If anyone from the audience has any queries or would like to share their thoughts, kindly feel free to raise your hand. Thank you, sir, for that exceptionally illuminating, thought-provoking and erudite session. We now move on to a moment of appreciation. It's an honor to present the Certificate of Appreciation to Mr. Jayesh Janardhanan, sir, for his valuable time, insightful session and meaningful contribution. As a token of our gratitude, we are pleased to share the certificate with you virtually, sir. Your discourse has not only augmented our understanding, but has also inspired us to embrace innovation, adaptability, and intellectual curiosity in navigating the evolving paradigms of modern healthcare. Gratitude is indeed the noblest expression of acknowledgement. As we drew the curtains on this intellectually invigorating session, let us carry forward the knowledge, inspiration, and insights we have gained today into our academic pursuits and professional trajectories. Thank you all for your esteemed presence and active participation. May we continue to strive for excellence with unwavering dedication and integrity. To formally articulate our appreciation, I now invite Ms. Karthika S. Nair, final year physician associate, to propose a vote of thanks.
Om Amriteshwari Nama. Respected dignitaries, esteemed guests, faculty members, dear alumni, and my dear friends, a very warm good evening to all. I am Karthika S. Nair, final year physician associate. I am truly honored and privileged to propose the vote of thanks for this wonderful occasion. First and foremost, we humbly extend our deepest gratitude to our beloved Mother Amritanandamayi Devi for being the guiding light and inspiration behind all our endeavors. Her vision, values, and blessings continue to shape not only this institution, but also each one of us who are part of this family. Next, I express my heartfelt gratitude to our most respected Dr. Prem Nair Sir, Group Medical Director and Provost AMRITA Hospitals, for his inspiring presidential address and for gracing this event with his valuable presence. Thank you, sir. Next, I extend my gratitude to Dr. Anant Kumar Sir for your inspiring presence and valuable words. We were truly delighted to know that Mr. Jayesh Sir was your favorite student. Sir, your presence today beautifully reflects the strong bond you share with your students. We were sincerely grateful for your time and encouragement. Thank you, sir. My heartfelt appreciation also goes to Sri M.V.G. Thambi Sir, Chief Program Administrator, AMRITA School of Allied Health Sciences, Kochi, for his kind presence and felicitation. Thank you, sir. My sincere thanks to all the respected faculty members of various departments for their presence and support. Thank you all. I would like to express my gratitude to Dr. Prasad VG Sir for the wonderful introduction of the speaker and for his contributions as a mentor and coordinator for transplant surgeries. Thank you, sir. A special thanks to Mr. Jayesh Sir for conducting such an insightful and motivating mentoring session. Your words have truly inspired all of us. Indeed, it was an eye-opener to the youngsters and the future alumni of this institution. Thank you, sir. I also take this opportunity to sincerely thank our organizer, Dr. P.G. Nair Madam, Emeritus Professor of Pharmacology and Chief Coordinator for Kochi Campus Alumni, and all other organizers of this alumni committee for their excellent planning and the successful execution of this program. Thank you, ma'am. I also extend my gratitude to all my teachers, non-teaching staffs, alumni participants on and offline, and students for your enthusiastic participation and support. Thank you all. I also take this opportunity to extend my gratitude to all the respected ashramates who graced this event with their valuable presence, especially Brahmacharini Rehanaji. Thank you, ma'am. Behind the scenes, we have many unsung heroes I would like to thank. Our technical experts of audio-video team, event coordinates, catering team for their hospitality, and especially our security staffs who ensure the smooth and safe conduct of this event. Thank you all. Finally, I thank each and every one of you present here today and online for making this program a grand success. Thank you all once again. I now request everyone to kindly raise for their national anthem, played in by violin by our alumnus Dr. Siddharth Vishwanathan, who is a vascular surgeon at AIMS Kochi. Thank you. Refreshments are waiting outside. Please have it before you leave. Thank you all once again. Goodbye till we meet again. Thank you.